Nurse practitioners are often stereotyped to be mean and dismissing, yet most of them have a desire to treat patients with high-quality care. The thing that makes nurse practitioners different is why they do it. I spoke with Scott County Hospital's nurse practitioner, Melissa Batterton, to get insight into what she does and why she does it. Most nurse practitioners have the same title, yet their day-to-day life is very different.
A nurse practitioner is a person that goes to school to be a registered nurse initially. You become a registered nurse and work as a registered nurse for a period of time, and then go on to graduate school for advanced training. When you graduate, you are a healthcare provider that can see patients for sickness or chronic care and prescribe medicines in collaboration with a physician. On a daily basis, I work in a clinic and the ER at a rural hospital here in Scott City. On most days, I see patients in the clinic, and sometimes they're sick people, sometimes they're people with chronic health problems, sometimes they're well child visits for kids or adults. And then on some days, I work in the ER and see anybody that comes into the ER.
Being a nurse practitioner requires not just becoming an RN, but also holding multiple degrees above that.
I think the biggest challenge was working in the emergency room, because when I graduated nurse practitioner school, my program was focused on family practice and primary care. And with most jobs in rural areas, you work in the ER, and that wasn't a lot of my training. So I had to learn some of that as I started. And I had a doctor I worked with, so that was fine.
After hearing Melissa's answers, I asked her some other questions about what being a nurse practitioner means to her.
I think it definitely makes me more tolerant to people and understanding of people from different backgrounds and different situations. Because in the ER, you see people at their worst. You see everybody on their worst day ever. But then you also see people from very different backgrounds as yourself, or home situations as I would have known. And I wouldn't have probably seen that if I'd have been in a different job.
In rural areas especially, RNs and nurse practitioners are hard to find. So nurse practitioners fill that gap and more. For BBN, I'm Maggie Hineman.